hospital is already busy, even though the day has barely begun. Phones ring at the reception desk, nurses move quickly through the hallways. Patients fill the waiting area while announcements echo softly through the building. Near the entrance, Emma stands quietly, holding a small interpreter notebook against her chest. Today is her first day at the hospital. She watches people speaking quickly around her and feels her stomach tighten with nervousness.
What if I don't understand them? What if they speak too fast?
Emma takes a slow breath and looks around the crowded reception area. Everyone seems confident. Everyone seems to know exactly what they're doing. Rianne approaches, carrying 2 cups of coffee, and notices the worried expression on her face.
First day nerves.
Is it that obvious?
A little.
I'm worried I'll make mistakes.
Everyone makes mistakes. The important thing is to keep communicating.
I hope you're right.
You don't need perfect English today. You just need to help people understand each other.
Emma listens carefully. Part of her knows Rianne is right. Another part is still afraid.
I'm here to help.
Exactly. That's one of the most useful sentences you can learn.
Could you repeat that, please?
Perfect. Nobody understands everything the first time. Good communicators ask questions.
A new patient enters through the main doors. The reception area grows busier. Emma closes her notebook and slips it into her pocket. The nervousness is still there, but so is determination. And with that, her first hospital day officially begins. The morning rush has begun. The reception area is crowded with patients carrying medical papers, appointment slips, and insurance documents. Phones ring constantly. The line at the reception desk grows longer every minute. Emma stands beside the receptionist, doing her best to stay calm. A middle-aged man approaches the counter looking confused and slightly frustrated.
Excuse me. I'm not sure where I'm supposed to go.
Can you help him, Emma?
Of course.
Someone told me to visit room 204, but I can't find it anywhere.
Emma feels a small wave of panic. She knows the answer is probably simple, but the patient's nervous tone makes her doubt herself.
Could you tell me your name, please?
Michael Carter.
Let me check.
Emma quickly looks through the appointment records and finds the information she needs. Her confidence returns almost immediately.
I found your appointment. You're scheduled to see Dr. Miller.
Good. I was worried I'd come to the wrong place.
Please follow me.
Thank you.
As they walk through the hallway, another patient approaches, holding several documents. She looks equally confused.
Sorry. Can you help me?
How can I help you?
I need to update my information, but I'm not sure which form to complete.
I can show you the correct one.
That would be great.
A few minutes later, Emma returns to the reception desk. The morning is still busy. The phones are still ringing, but something feels different. She is no longer frozen by nervousness.
You're doing well.
Really?
Absolutely. Most people struggle on their first day.
Thank you for your patience.
You're welcome.
Have a nice day.
Thank you. You too.
The line continues moving. New patients continue arriving, and little by little, Emma begins to realize that communication isn't about knowing every word. It's about staying calm and helping people one conversation at a time. Later that morning, Emma is asked to assist during a patient consultation. The consultation room is much quieter than the reception area. A computer screen glows softly beside several medical files while Dr. Miller reviews the patient's records. Across the desk, a tired patient rubs his forehead and prepares to explain his symptoms. Emma takes a seat nearby and opens her notebook. Although she looks calm, she still feels nervous inside.
Good morning. Can you tell us what's been bothering you?
I've been feeling exhausted for weeks. I get headaches almost every day, and lately I've been having trouble sleeping.
The patient speaks quickly. Several unfamiliar medical terms appear in the conversation. For a moment, Emma struggles to keep up. Dr. Miller notices her expression and gives her a reassuring smile.
Take your time.
Could you say that again, please?
Of course. I've been feeling tired all the time, and my headaches seem to be getting worse.
Thank you. That's much easier to understand.
When did the symptoms begin?
About 2 months ago. At first, I thought it was just stress.
Can you speak a little more slowly?
Sure. The headaches started around 2 months ago. Then I began feeling tired almost every day.
That's helpful information.
Emma notices something important. When she asks for clarification, the conversation becomes easier. The patient doesn't seem annoyed. In fact, he seems happy to explain.
Sometimes I worry that I'm not explaining things clearly.
I understand.
Thank you.
We'll ask a few more questions and then discuss the next steps.
Okay.
Could you explain that?
Certainly. We'll review your test results and decide whether additional tests are necessary.
Emma nods as she follows the explanation.
Will I receive the results today?
Some results will be available today. Others may take longer.
Let me make sure I understand. So some results will come today, and the remaining results will arrive later?
Exactly.
That makes sense.
The consultation continues smoothly. Emma is still learning, but she is no longer afraid to ask questions when she needs help. As the meeting comes to an end, Dr. Miller closes the patient's file.
You did well today, Emma.
Thank you for your help.
You're welcome.
As the patient leaves the room, Emma closes her notebook. The reception desk tested her confidence. This consultation tested her listening skills, and the day is only beginning. The emergency department is much busier than anything Emma has seen today. Monitor alarms beep in nearby rooms. Doctors move quickly through the hallway. Patients arrive one after another. Emma follows a nurse into a treatment room where a worried patient sits on a hospital bed.
I'm sorry. I'm feeling really nervous.
It's okay. We're here to help you.
Can you tell me exactly what happened?
I was walking downstairs when my heart suddenly started beating very fast. Then I felt dizzy. For a moment, I thought I might faint.
Emma struggles to follow the patient's fast explanation.
Please speak slowly.
Sorry. My heart started racing first. Then I became dizzy.
Good. Now ask about any chest pain.
Are you feeling any pain in your chest?
A little pressure, but not severe pain.
And ask if she has eaten anything today.
Have you eaten anything today?
Only coffee this morning.
Emma notices something surprising. The conversation is still stressful. The emergency room is still noisy. But she is no longer panicking. She is listening carefully and asking the right questions.
Am I going to be okay?
We're checking everything carefully. Try to stay relaxed.
The nurse is here to help you.
Thank you. The patient finally seems a little calmer.
You stayed calm under pressure. That helped a lot. Emma smiles quietly.
In difficult situations, people don't need perfect English. They need clear communication, and little by little, Emma is learning how to provide it. Late afternoon rain taps softly against the hospital windows. The waiting area is quieter than the emergency department, but the tension feels just as heavy. A woman walks back and forth near the seating area, holding her phone tightly. Emma notices how worried she looks and approaches her gently.
Excuse me, has anyone given an update about my husband yet?
I'm not sure, but I'll try to help.
I've been waiting for hours. Nobody is answering my questions.
I understand how you feel.
I just want to know if he's okay.
Let me check for you.
The woman nods gratefully. A few minutes later, Emma returns with updated information from the staff.
The doctors are still examining him. They're continuing the tests.
So nothing is seriously wrong?
The doctor will give you more information soon.
I'm trying to stay calm, but it's difficult.
Everything will be okay.
The woman manages a small smile.
Thank you. That helps more than you realize.
Emma knows she cannot solve every problem. She cannot change test results. She cannot make doctors work faster. But she is beginning to understand something important. Sometimes, people don't need perfect answers. They simply need someone who listens. The woman takes a deep breath and sits down for the first time in nearly an hour.
I think I'm feeling a little better now.
Please let me know if you need anything.
I will. Thank you for your kindness.
Emma smiles warmly. Compassion is a language everyone understands, and today, Emma is becoming more fluent in it. The evening shift is slowly approaching. The hospital pharmacy is quieter than the waiting areas, but many patients still have questions before going home. Emma stands near the pharmacy counter when an elderly patient approaches, holding a medicine bag and several prescription papers.
Excuse me. I'm a little confused about these instructions.
Of course. Let's take a look.
The pharmacist explained everything, but there was too much information. I'm afraid I'll take the medicine the wrong way.
Could you explain that again, please?
Yes, that's exactly what I wanted to ask.
Emma speaks with the pharmacist and returns a few moments later.
The pharmacist will explain it one more time.
This medicine should be taken after meals, twice a day, once in the morning and once in the evening.
After meals? Not before meals?
That's correct. Always after meals.
Let me make sure I understand.
So I take one tablet after breakfast and another after dinner.
Exactly.
That's much clearer now.
Emma notices that misunderstanding instructions can be stressful. A small mistake could create unnecessary worry. Careful listening suddenly feels more important than ever.
Sometimes medical English is difficult for me.
I understand. There are a lot of new words.
I always worry about making mistakes.
It's okay to ask questions.
You're right. I shouldn't be embarrassed.
Thank you for explaining.
No. Thank you for helping me understand.
The patient carefully places the prescription papers back into the medicine bag.
Now I feel much more confident about taking the medicine correctly.
Good communication is not only about speaking clearly, it's also about making sure the other person truly understands. And today, Emma is learning both. Night has finally arrived. Rain taps softly against the break room windows while the hospital grows a little quieter. Emma and Rianne sit at a small table with coffee cups between them. Emma's notebook lies open beside her, filled with phrases, corrections, and handwritten notes from the day.
You handled a lot today.
Honestly, this morning I thought I was going to fail.
Really?
Everyone was speaking so fast. I kept worrying that I would miss something important.
But you didn't quit.
Emma smiles.
There were moments when I wanted to, but every conversation became a little easier.
Emma flips through the pages of her notebook. The first pages are filled with nervous notes. The later pages are much more organized. Without realizing it, she has become more confident throughout the day.
What's the biggest thing you learned?
I understand now.
And what do you understand now?
That communication isn't about speaking perfectly. It's about staying calm and helping people understand each other.
Rianne nods approvingly.
That's a lesson many people never learn.
I'm getting better every day.
You definitely are.
Emma laughs softly.
This morning I was afraid to speak. Now I'm actually starting conversations.
That's real progress.
Outside the window, the rain continues to fall. Inside the break room, Emma feels something she hasn't felt all day. Relief. Not because the day was easy, but because she proved to herself that she could handle it.
I'm proud of myself.
Rianne smiles. And you should be.
You've earned it.
For the first time since arriving at the hospital, Emma stops worrying about what might go wrong. Instead, she starts thinking about how much she has already improved. Later that evening, the hospital cafeteria is nearly empty. The busiest part of the day is over. Emma, Rianne, and Dr. Miller sit around a small table with warm drinks and notebooks scattered between them. The atmosphere is relaxed for the first time all day.
So, Emma, let's see how much you remember.
Emma laughs nervously.
Uh-oh, that sounds dangerous.
Don't worry. Think of it as a friendly challenge.
I'll describe a situation. You tell me what you would say.
Okay, I'm ready.
A patient is speaking too quickly.
Please speak slowly.
Good. A family member is worried and waiting for news.
Everything will be okay.
Nice. That one came quickly.
Emma smiles.
A patient doesn't understand medication instructions.
Could you explain that again, please?
Excellent. You're remembering these much faster now.
Emma notices something surprising. Earlier today, she had to stop and think before every sentence. Now the phrases come naturally.
One more. What would you say if someone feels embarrassed about asking questions?
It's okay to ask questions.
Perfect.
And what would you say if someone needs help?
Please let me know if you need anything.
Very good.
Actually, I have one for both of you.
Oh, now we're being tested.
Yes. What should someone say when they're improving and starting to feel more confident?
Rianne and Dr. Miller look at each other and laugh.
I'm getting better every day.
That's definitely the correct answer.
The three of them continue talking and laughing. The hospital day that began with nervousness is ending very differently. Emma is no longer focused on her mistakes. She's focused on her progress. And that makes all the difference. The rain has finally stopped. Outside the hospital, the wet pavement reflects the glow of street lights and distant ambulance lights. Emma and Rianne walk slowly down the entrance steps, each holding a warm cup of coffee. For the first time all day, there is nothing urgent waiting for them.
How are you feeling now?
Emma looks back at the hospital building.
Honestly, tired, but in a good way.
That's usually how growth feels.
Emma smiles.
This morning, I thought everyone was going to judge my English.
And what happened instead?
Most people were just trying to communicate. The patients weren't expecting perfection. They just wanted help.
Emma holds her notebook loosely at her side. Earlier that morning, she carried it like a safety blanket. Now, it feels more like a record of everything she learned.
What's the biggest difference between the Emma from this morning and the Emma standing here now?
Emma thinks for a moment.
I'm not afraid to try.
That's a powerful change.
I still make mistakes, but they don't scare me as much anymore.
Good. Because mistakes are part of learning. They always will be.
The two continue walking toward the parking area.
You know, I used to think confidence came first. Now I think confidence comes after you keep trying.
I couldn't have said it better myself.
Emma smiles and looks up at the night sky.
I can do this.
Yes, you can.
The hospital grows smaller behind them as they walk away, but the lessons Emma learned there will stay with her long after tonight. Some days change your skills, other days change how you see yourself. For Emma, today did both. The rain has completely stopped. Outside the hospital parking entrance, the night is calm and quiet. Streetlights reflect softly across the wet pavement, while distant ambulance lights glow faintly behind the building. Emma and Rianne stand together finishing their coffee. The long hospital day is finally over.
This morning, you weren't sure you could do this.
I remember. Honestly, I was terrified.
And now?
Emma looks toward the hospital windows for a moment. The same building that felt overwhelming this morning now feels strangely familiar. A quiet smile appears on her face.
I'm not afraid to speak anymore.
That's a big difference from this morning.
I know. I still have a lot to learn, but now I'm excited to learn it.
Emma lowers her eyes to the notebook in her hands. Its pages are filled with nervous notes, corrected phrases, rushed handwriting, and moments she once thought she couldn't handle. Earlier, those pages felt like proof of everything she didn't know. Now they feel like proof of how far she has come.
So, what's next?
Emma gently closes the notebook and holds it against her side.
Every conversation teaches me something new.
That's exactly the right attitude.
Today taught me something important. People don't remember perfect grammar. They remember kindness. They remember patience. And they remember how you made them feel.
I think you've learned more than English today.
Maybe I have.
The hospital doors open and close quietly behind them as tired workers slowly leave for the night. The day began with fear, uncertainty, and self-doubt. But somewhere between the conversations, the mistakes, and the challenges, something changed. Many people study English for years, but confidence rarely grows inside perfect practice sessions. It grows during real conversations, real pressure, real emotions, and real human connection. As Emma takes one final look toward the hospital before walking away, she realizes something she didn't understand that morning. English is no longer something she is trying to learn. It has become something she is brave enough to live. And that changes everything.